Well, it's Tuesday, and that means Dr. Richard Jackson with Changes Medical Spa and Laser Center is here with us. I missed you last week, but I heard Angela was here instead of you, right? So I'm glad you're back with us today. So what are we talking about today?
Okay, today we're talking about Botox and Xeomin.
Okay, and what is that? What's the difference?
Well, those are both muscle relaxers. They're both excellent products, and unit for unit, they're pretty much equivalent. And they're used for, usually in aesthetics, they're used for relaxing muscles that are causing wrinkles. So if the wrinkle is not caused by a muscle contraction, they won't do much for it, but they're very effective if you have an area where muscles are causing wrinkles. And we get a lot of questions about some people are confused about what's the difference between dermal fillers and Botox. And well, again, dermal fillers add volume. They help replace volume, and they will fill up an area where the volume's deficient. And Botox and Xeomin don't do that. That's not how they work. All they do is relax muscles in the area where they're injected.
So you're talking about a muscle that may be causing you to have the wrinkles.
Right.
So this is injected and it just basically releases that and flatten it out.
Exactly.
Okay.
And sometimes it's necessary before you do another procedure, like a laser procedure, if the wrinkles are really deeply set. But if the wrinkles are fairly mild, they may go completely away.
Now, with the Botox and the Xeomin, about how long does that usually last?
Typically around 6 months, although it depends on how much you inject and what area that you're treating.
And what areas can you treat?
The most common area is the middle of the lower forehead, or also called the glabella. And those are strong muscles. Usually takes about 20 units, give or take.
We frown.
And usually they cause vertical frown lines, at least eventually. And a lot of people like to get rid of those because it gives them kind of a fresher and sometimes a less angry appearance.
And that's kind of the focal point of your face, is right there. That's where you look first. So if that's gone away, it kind of makes everything else look refreshed.
Next most common area is the upper forehead, where people get horizontal lines. Not everybody does, but some people have stronger muscles in that area, and they can be really prominent ridges. And then another area where a lot of people get them is on the corners of the eyes and under the eyes.
Oh. Now, once it's injected, how long does it take to work? Is it instant? Or?
No, it's not instant. It takes a few days, sometimes a week, and people gradually start seeing that they have less and less movement in the area. And they're very safe. We do things a little different at Changes Medical Spa because, first of all the injections are given by a physician, that's me, and we don't use a nurse injector or an assistant or anything. I do everything, and I take my time and I talk to people and I try to understand their individual facial anatomy, size of the muscles, how much they need, and what effect they're trying to achieve.
And I think that's why people continue to come back to you, because you do listen, and we appreciate you for that. So tell me a little bit more. Botox and Xeomin, same thing, only different, just different brand names?
They're very similar, and essentially for most people, it's just a difference of brands. For some purposes, especially where people are getting higher doses for a long time, we prefer Xeomin a little better, but usually it makes little clinical difference.
Oh, interesting. Do we have a good day deal on this?
We do. $10 Tuesdays for the rest of July. Normally the price is $12 per unit, and we only charge by the unit, and that lets people get exactly what they pay for. We don't charge by the area, where sometimes the cost is a lot higher, even for a smaller number of units. And we also do a follow-up visit in 10 days or 2 weeks, where I want to make sure that people have gotten the right amount, because sometimes if a person's new to it or doesn't know what dose they need, I'll start on the low side because I don't want to cause an overcorrection.
Nice.
And We can add a little bit more if people need it after a couple of weeks. The injections are not totally painless, but we use a cooler to help reduce most of the sensation, and I use the tiniest needles that I can get.
Nice. And so that way they know you're getting exactly what you need and not more. And that's what I love about Dr. J is he does not push the product. He only gives you what you need and starts slow with you, and that's what we appreciate. That is Dr. Richard Jackson at Changes Medical Spa and Laser Center. Look for the Good Day deal on Tuesdays. It's highly recommended that you make an appointment. I think the Tuesdays are going to fill up through July. Thank you, Dr. J.
Thank you.